Let's talk about the future regulatory changes that we think are happening. I think the first thing to say is really important is that we don't know the exact specification that the government will use for licensing, but it's very clear that local authorities will be licensing both the premises and the practitioner, and there will be an agreed education standard. And we believe that that future standard will still be mapped to the original Health Education England guidelines that were put forward about 7 years ago. So what does that mean? It means that for us, we're going to continue providing the best quality level 7 qualifications available. And this is for healthcare professionals who already have a level 6 bachelor's degree, who can then do postgraduate education to the level 7 standard. So timelines for when all of this is happening. In 2022, the government are going to include in the new Health and Social Care Act some requirements for licensing, but that doesn't mean that it's going to be perfectly clear from this moment onwards. There's going to be a 2-year consultation window where specialists and the public are consulted as to defining this final education standard. So we think in another couple of years there will be absolute crystal clarity on the precise education standard that everyone has to get to undergo licensing. What does this mean for practitioners who are already experienced? Do they need to do a qualification? There are 2 options available. Number 1 is you can still get the full qualification, the level 7 diploma, and you can get that through a university or through an off-qual regulated route such as ourselves. There's also something called the JCCP fast track, which is a non-qualification route, which gives practitioners with 3 years experience a process by which they can pass an exam to get an equivalent standard to what we believe is this future licensing requirement. But in that process, you don't actually get a qualification in injectables. At Harley Academy, we offer our full level 7 diploma, we offer our level 7 fast track, and we offer the JCCP non-qualification fast track. So I just want to talk about the difference between the first 2. You can enroll onto the full level 7 diploma if you're brand new to aesthetics and you want a really structured pathway to get your experience up. That includes all of the mentoring, all of the assessment, all of the shadowing, and of course all of the online learning and support. If you're already experienced and you want to get a qualification, the level 7 diploma, then you can do the level 7 fast track, and that will require you to submit a portfolio of evidence and then sit the assessment components of the exam. At Harley Academy, one of our key philosophies has always been skin first. We want to offer our patients the least invasive treatments before moving on to, for example, injectables and other treatments. And so we have at Harley Academy our cosmetic dermatology program, which is often done in combination with our level 7 for injectables. The cosmetic dermatology program isn't accredited, it's not a qualification, but it's a really structured pathway for healthcare professionals to become experts in this cosmetic skin science, the cosmetic dermatology aspects of routine aesthetic medicine. So that includes topical skincare, it includes chemical peels, it includes mesotherapy and skin injections, it includes microneedling, and it includes an enormous amount of dermatology knowledge on top. And that's delivered through some practical sessions and some online learning. And for practitioners who have combined their skin knowledge with their injectables knowledge, they're generally very holistic practitioners that can start treating a huge variety of aesthetics concerns straight from day one.